Hello, everyone. Thank you for joining the Needy Med Special Topic webinar, Rare Disease Healthcare Cost Assistance, presented by our partner, the PAN Foundation. Thanks so much for being here. And as always, before we dive into today's presentation, I'm going to offer just a few tips so you can make the most of it. First of all, of course, we encourage you to ask questions at any time by typing them in either to the Q&A or chat section of your Zoom control panel. Just know we will reserve answering questions until the end. Of course, if we don't get the chance to answer your question, because we do keep the Q&A portion of the presentations relatively brief, we will follow up with you via email as soon as we can. However, if you do need an immediate answer, we encourage you to reach out directly to either the PAN Foundation or Needy Meds. And of course, that contact information will follow. So let's get started really quickly with what is Needy Meds, just for those of you not yet familiar with who we are and what we do. Simply put, Needy Meds is a national nonprofit. We were founded about 25 years ago, and what you're looking at on the screen is our mission statement. Needy Meds connects people to programs that help them afford their healthcare expenses. And we do this free and anonymously through our website, needymeds.org, and our toll-free helpline, 1-800-503-6897. And as you saw in the slide just a couple ago, a big part of the Needy Meds mission is education. And we fulfill that part of our mission, certainly by educating people about Needy Meds and the healthcare savings and educational resources we offer. But we also fulfill the education part of the Needy Meds mission by informing and educating our users about other resources that will help them on their healthcare journey, which is why we are so proud to have a partnership with the PAN Foundation and a guest joining us today to tell you all about the invaluable services, resources, and information they provide. So before I introduce our guest, let me tell you a little bit about the PAN Foundation. They help underinsured people with life-threatening, chronic, and rare diseases get the medications and treatment they need. And they do that by paying for their out-of-pocket costs and advocating for improved access and affordability. Really important mission. So now that I told you just a little bit of the PAN Foundation, as you can see, what you're looking at on the screen is a snapshot of their website. It's really well designed, super easy to navigate. So I absolutely encourage you to peruse through it, check it out after this webinar or when time allows. Now, I am thrilled to let you know that we do have my colleague and friend from the PAN Foundation, James Ridley, go over today how the PAN Foundation can help those living with rare disease get healthcare cost assistance. So James Ridley is the Senior Manager of Clinical Affairs at the PAN Foundation, and he actually started his career in retail pharmacy management. And before joining the PAN team, was actually a pharmacist for the Department of Defense, where he gained valuable experience in medication management and patient care. Additionally, James serves as a faculty member at Walden University School of Nursing and founded JJRX Health Consultancy. James earned his Doctor of Pharmacy from Hampton University in 2016 and is a licensed pharmacist with the Virginia Board of Pharmacy. So as you can tell with that resume, we are really excited to have him here sharing his expertise with Needy Meds users. So hopefully seamlessly now, I'll be able to pass the screen over to James. And he's grabbing that screen. I will remind everybody that you can submit questions again by typing them into the chat or Q&A section of that Zoom control bar. So James, that slideshow is up in slideshow mode. So we are ready to go. And with that, I will pass the mic to James. Thanks for being here, everyone, and enjoy the presentation.
Thank you, Carla, for your warm introduction. Hello, everyone. I am so glad that you're able to join us for this webinar on finding financial assistance for patients with rare diseases at the Patient Access Network Foundation, also known as PAN Foundation. My name is James Ridley, and I am the Senior Manager of Clinical Affairs here at PAN. Today, I would like to speak to you about our rare diseases, about our outreach to the rare disease communities. At the PAN Foundation, we are committed to helping people living with rare diseases to find financial support. I am excited to connect with the rare disease community today and share our resources with you all. On today's agenda, I will introduce you to who we are, the impact and assistance we have available for patients with rare diseases, and how you can apply and receive financial support from the PAN Foundation. Please send us your questions during the webinar in the chat box. The financial impact of rare diseases. Okay, let us go ahead and get started on why we do what we do. There's approximately 7,000 to 10,000 known rare diseases, and many are life-threatening, hard to diagnose and treat. According to an NIH study in 2021, rare diseases collectively affected 25 to 30 million people in the US alone. The annual direct medical cost is estimated at 400 billion, similar to those with cancer, Alzheimer's, and heart disease. The estimated treatment cost per person ranges from $8,000 to over $140,000 per year. In fact, individuals with rare diseases face medical costs 3 to 5 times greater than those who do not have rare diseases. Copay foundations can help alleviate some of the out-of-pocket burdens. For these patients, access to medically necessary treatment is critical for successful disease outcomes. However, this access can be blocked by the high out-of-pocket costs, which can add up quickly, increasing the financial burden. And so, finding financial help to cover out-of-pocket costs is vital for survivorship. So let's talk a little about PAN. At the PAN Foundation, we believe that out-of-pocket costs should not prevent anyone from obtaining medical necessary treatment. So today, I will share how PAN can help remove some of the financial barriers and alleviate high out-of-pocket costs for those with rare diseases. Let us get started with who we are. PAN is a national patient assistance organization that helps underinsured people pay for their out-of-pocket treatment costs while advocating for more affordable care. Since the founding in 2004, we have provided over 1 million underinsured patients with over $4 billion in financial assistance. We have over 70 disease funds, of which over 25 are for rare diseases, and hope to continue expanding to reach and assist more people. Why we exist. Medicare Part D, established in 2003, covers outpatient prescription drugs, but often requires beneficiaries to pay significant co-payments, sometimes totaling thousands of dollars. Pharmaceutical companies can assist commercially insured patients with co-pays, but providing direct financial aid to Medicare Part D beneficiaries raise concerns under the anti-kickback, which prohibits actions that might persuade beneficiaries to purchase Medicare-covered drugs. This creates a challenging landscape where companies must balance the need for co-payment assistance with legal compliance. Addressing these challenges carefully with considerations and innovative solutions to ensure beneficiaries access to necessary medications while adhering to regulatory guidelines. So the current need for charitable assistance. 47% of US adults said that it is very or somewhat difficult to afford their healthcare costs. And while 50% said they would be unable to pay a $500 unexpected medical bill without borrowing money. So now let's talk about our funds. We provide funding for three distinct areas for rare diseases. Currently, we have three types of assistance programs to help patients with their out-of-pocket costs. The first program is our medication assistance program, which assists patients with deductibles, co-payments, and coinsurance for their medications. The second program is our premium assistance program, which assists patients in paying monthly primary or secondary health insurance premiums. The third program is our transportation assistance program. The program covers travel expenses for patients' treatment visits. Once approved, the transportation assistance program covers gas, ride shares, car rentals, parking, and airfare. We also cover approved lodging such as hotels, bed and breakfast, and temporary housing. I also want to note that to qualify for our transportation program, the patient must be enrolled in one of our medication assistance programs. Finally, the transportation assistance program is not limited to rare diseases only, but it covers all diseases that PAN supports, including chronic diseases and oncology. Also, our programs are allocated in the form of financial grants to help patients pay for prescribed medications, transportation, and insurance premiums. PAN offers more than 25 rare disease funds. As mentioned previously, more than 25 of our rare disease funds help cover patients' out-of-pocket costs. Overall, we provide assistance across 70 plus disease funds ranging from chronic, rare, and oncology diseases. To see a complete list and current statuses of our programs, please visit our website at panfoundation.org. So finding a disease fund. To find information about specific disease funds, please go to www.panfoundation.org/funds. This is an example of what the web page looked like. Here you will find fund status, covered medications, eligibility criteria, assistance amounts, services, and alliance partners, and diagnosis codes. Understanding our fund statuses. There are three fund statuses at PAN: open, closed, and open in waitlist only. Open. When a fund is open, it means that funding is currently available and the disease fund is open to all to apply, for all to apply, sorry. Closed. When a fund is closed, it means that funding is currently not available in the disease fund. If you are interested in applying for assistance when it opens, you can add yourself to the wait list. You will receive notification when the funds open in waitlist status to apply. And waitlist, which brings us to our final status. Open in waitlist means funding is currently available for the disease fund, but it is only open to those on the wait list. Therefore, only individuals on the wait list can apply during this status. It is critical to understand the difference between open, close, and wait list. How our grants work. Assistance amounts are tailored to each disease fund and cover the average annual out-of-pocket treatment costs associated with each disease. We aim to remove patients' financial burden while they navigate the challenges of managing their healthcare expenses. Our program enrolls patients for a 12-month eligibility period. This includes a 3-month look-back period for each new grant. Patients or their healthcare professionals should submit a claim or reimbursement request every 120 days. The structured approach allows us to address patient needs in a timely and organized manner. If we do not receive a paid claim within 90 days, we'll send a letter. If we haven't heard back by the 120th day, the funds are released to help others in need, making sure our resources are distributed effectively. We understand that some patients may require ongoing assistance, and we are committed to supporting those who rely on our programs. If you are eligible for renewal, you can apply 1 month before your eligibility period ends. However, please note that this option is subject to funding availability. If this feels like a lot of information, don't worry. All of it is available on our website for your review. So, coverage of medications. A common question we receive is what medications we cover. Every disease fund has a list of covered drugs considered for reimbursement. PAN is also diagnosis based. So, in addition to our formulary, we also have a complete list of covered diagnosis codes under each disease fund. For each disease fund, we cover FDA approved medications and listed in compendia or evidence based guidelines indicated for a specific disease state. These include all prescription medications in the fund formulary, such as brand and generic medications, bioequivalent or biosimilar medications, and specialty drugs. Now that you know that PAN covers and what PAN covers, let's briefly touch upon what is not covered, since we receive requests for payments for these products and services. First, PAN is a payer of last resort, which means we pay the patient's responsibility or out-of-pocket costs for after the insurance makes a payment. Therefore, we do not reimburse any medications which is covered at 100% by the health insurance or medication the insurance did not make any payment on. Also, as discussed earlier, the medication must be on the disease fund formulary to be considered for reimbursement. Finally, we do not cover services such as doctor visits, lab work, genetic testing, ER, or hospital visits, and diagnostic testing. So, disease fund and subtypes. We always list subtypes available for each disease fund. Subtypes can be found in the About the Disease section of the specific disease fund. Patients or their provider or pharmacy can search for the disease fund subtypes. A transportation assistant. As previously mentioned, PAN also has a transportation add-on program for patients enrolled in a copay disease fund. The transportation program offers $500 for travel to and from their doctors or pharmacy visits. It covers all major modes of transportation and lodging in a form of a prepaid debit card. The impact of PAN transportation grants. A survey of patients showed improved quality of life. Patients were able to visit doctors and pick up prescriptions more reliably. And we have expanded the grant to focus on patients' overall health. How to apply for a grant. The next few slides will focus on applying for assistance with PAN. There are 4 easy steps to keep in mind when applying. Check if the fund is open, verify your eligibility criteria for the fund, gather all required information, submit application, and you'll find out instantly if you've been approved and can begin using your grant right away. So, step 1, check to see if the disease fund is open. There are several ways to do this. You can go on our website. Also, another way is by visiting our portal to verify the fund status under the Disease Fund and Medications tab. And lastly, you can call PAN to verify the status of all of our disease funds. Verify eligibility criteria is met. In this step, we verify if you meet the eligibility criteria for the disease fund you are applying to. The following are our eligibility guidelines for all of our disease funds. 1, you must be getting treatment for a specific disease. fund you are applying to. This means if you are applying for an assistance for a rare disease, you must have that diagnosis or one of the subtypes under that rare disease fund. The medication or product must be listed on the specific disease fund formulary and must be covered by your health insurance. The patient's income must fall between 400 and 500 at or below the federal poverty level specified by the assistance program. It is very important to note that the insurance and income guidelines vary for each assistance program. So be sure to verify this and all the program guidelines on the specific disease fund page. The patient must live and receive treatment in the US or US territories, although US citizenship is not required. Certain programs, such as a transportation fund, have additional requirements, so please check the PAN website for more details. Using our homepage eligibility tool, patients and their caregivers, providers, or pharmacists can check a patient's eligibility for a disease fund and begin the application process right from the PAN Foundation homepage. And gather all required information. If you meet all the criteria listed on the previous slide, you would need to gather the information before starting the application process. You need demographic information such as name, address, phone number, and email address, the diagnosis and medications that you are on, as well as your health insurance information. Also, your income and the number of people in your household. And lastly, the physician and facility contact information. Now you're ready to submit your application. There are 3 main ways to do this. As previously mentioned, you can apply directly on our website, apply using your existing portal account, or you can give us a call Monday through Friday from 9 a.m. to 5:30 p.m. Eastern Standard Time at 866-316-7263. So next steps. On average, it takes less than 10 minutes to complete an application, and our enrollment decision is instant. We will provide you with the enrollment details and processing information right away, email or mail to the patient, and then follow up with an email or fax to the enrolling physician upon request. Once you are enrolled, you can begin submitting your claims to PAN for reimbursement immediately. So patients benefits from our efficient enrollment process. 100% of applicants receive real-time income verifications. 10 seconds post-application submission needed on average to provide instant enrollment. There's a 9.8 satisfaction rating and 100% of grant funding available to patients upon approval. How PAN helps patients when a fund is closed. How the wait list works. The wait list is a list of patients waiting to apply for a closed copay, health insurance premium, or transportation grant. Patients may add themselves to the wait list or be added by their provider, pharmacy, or caregiver. You will get an email confirmation after submitting. When a wait list opens, you will get an email with a link when the wait list opens. You can apply online or by phone. You have 48 hours to apply before it opens to the public. Grants are provided in the order people join the wait list, first come, first served, not the order they are submitted with their application. Referrals. If a specific disease fund is closed, we want to ensure you still have access to valuable resources and assistance. For this purpose, we offer real-time referrals to other patient organizations that may be able to help you. These referrals are readily available on the individual disease fund pages, making it easy for you to find other support when required. Our top priority is ensuring patients have access to a broad network of resources. We are here to guide you to the right place where you can get the help and support you need. Fund Finder. PAN has created a free web-based app called Fund Finder. This first of its kind web app helps all audiences track the disease fund statuses across 9 charitable copay assistant foundations. You can simply go to fundfinder.org, or you can find the link on our website. Once you sign up, you may follow any disease fund and receive notification alerts via email or text messaging, and the specific fund opens at any of the foundations. Fund Finder helps you save time by not having to check multiple websites frequently. Our goal is to help you find the support and resources you need to spend less time on the manual work. When a patient or caregiver applies at PAN, they are given an option to receive communications from all respective alliance partners. Our alliance partners will reach out directly to those interested in learning more if the patient opts in. Get involved and stay connected. Please connect with us on our various social media platforms. On this slide, you will see the names that are for each individual social media. We encourage you to spread the news about PAN. Now stay connected with the PAN updates. Sign up for email updates, learn about new programs, advocate for healthcare access, and get involved with the PAN community. We know that the PAN Foundation is one of many resources to help you with out-of-pocket costs, and we encourage you to reach out to us. By doing so, we can listen to your needs and understand how we can help. Thank you all so much for joining us today to learn more about the PAN Foundation and our programs. Please visit us on our website or give us a call Monday through Friday from 9 a.m. to 5:30 p.m. Eastern Standard Time. You may also reach out to me if you have any questions about a particular situation, and I will be more than happy to help. We look forward to assisting you soon. And again, thank you so much for your time. I will go ahead and turn it back to Carla, who will lead our question and answer section.
James, thank you so very much for that thorough and easy to understand explanation about how the PAN Foundation can help those living with rare disease find assistance affording their medications and other treatment needs. Now, before we get to the question and answer section, as James said, I just want to double check with him. James, are you looking at the slideshow version of my PowerPoint?
Yes.
Great, everybody. I just wanted to make sure it was as clear as can be. And I do see a lot of questions already coming in from our audience, which I'm not surprised, but I'm happy to see. You know, James, I really always enjoy our PAN Foundation presentations because it's an opportunity to showcase what exceptional healthcare cost savings and resources you all provide. But what I really like that you included in today's presentation also, James, is you certainly covered, you know, a lot of FAQs, but it's really important that you also covered what PAN isn't and what PAN doesn't offer. I think that really drives home the role the PAN Foundation can play in patients' lives when it comes to their healthcare costs. And it really makes things super clear. One of the things that I'm also happy to see is that transportation assist add-on, because that has to be invaluable for the patients and families you served. And one of the things that I also want to stress to our Needy Meds audience and beyond is really please check out that fundfinder.org destination, you will see for yourself very quickly why it is award winning and how easy it will make getting healthcare cost assistance when you need it. So I don't want to take up too much of your time explaining other resources that Needy Meds have, but I will mention them just so everybody knows. In the meantime, as I said, I do see some questions coming in, which is great. But again, just a reminder, how to submit questions, and you do that by simply typing your questions into the Q&A or chat section of that Zoom control panel. But again, thank you so much, James, for that really thorough and easy to understand presentation. Before we get to those questions coming in for James, again, a reminder that Needy Meds is also here as a source of healthcare savings support. What you're looking at on the screen are all of the categories you can find on needymeds.org under the healthcare savings tab, which will do just that, help you to save on medications and other healthcare needs. To learn more about Needy Meds and the healthcare savings and educational resources we offer, I encourage you to check out and sign up for one of our upcoming monthly overview webinars. You can find those on the calendar of events on the Needy Meds homepage. I'm also bringing up our calendar events because I'm happy to share that you will also find other PAN Foundation webinars. So be on the lookout for those and sign up early because they are popular and space is limited. So as promised, we're going to keep up the contact information for the PAN Foundation, and their website is panfoundation.org. Their toll-free call center number is 866-316-7263. And another website to keep in mind worth checking out again is fundfinder.org. At the bottom, you will see our website, needymeds.org, and the toll-free helpline that we have is 1-800-503-6897. And we're going to leave that contact information up. The heads up to everybody that today's presentation will be converted into a video and uploaded onto the Needy Meds YouTube channel. We do that so that you can revisit it as needed, since a ton of information was covered. And you can share it with family, friends, loved ones, and patients or clients that you think may be interested. So just the heads up about that. So James, we're going to go ahead and get to some of the questions that came in. And I do want to stress, we do keep the Q&A portion of these presentations relatively brief. So if you did ask a question and we don't get the chance to answer, our apologies. We will follow up with you as quickly as we can. However, again, if you do need a more timely response, check out our websites and reach out to our call centers as soon as you can. So James, one of the questions came in, and I think this is really important, is my rare disease is not on the PAN Foundation's list of disease funds. How can I request this fund? Great question.
Thank you. Thank you for your question. So if you do not see your rare disease on our list of disease funds, you can submit a message with the disease state to us via our Contact Us form on the website. In addition, you can also call us and submit a request. We consistently review disease states to find additional ways to assist patients with out-of-pocket costs. Although PAN may not support your disease state at this time, other charitable copay foundations may have the disease fund available. So we recommend signing up for Fund Finder to determine if your disease fund is available at another foundation.
Such an important question, and a great and not surprisingly super thorough answer from James. And, I really want to encourage those listening in to do exactly what James suggests. Reach out to the PAN Foundation and request that fund. That really is invaluable. It lets the PAN Foundation know what the patients they're helping to serve really need. And that's super important. And the other part of James's answer is that the PAN Foundation, if they can't be the answer, you're looking for, they do have a network of resources that they can refer you to. And I will mirror that sentiment for Needy Meds. Stay in touch with us. Reach out if you're looking for healthcare savings options. If we don't have what you need, let us know. Give us a call, submit some feedback on our social media uh, platforms, and just stay in touch with us because we do want to know how we can serve you better. Also, as I said, the great thing that we all can do at the PAN Foundation and Needy Meds is if we have any patients, caregivers, loved ones, or providers that turn to us and we don't have the answer, as I said, we all work to really find another nonprofit that may be that solution for you. So thanks for the question and the really thorough answer. So James, another question that came in. This attendee shared, my heart failure medication is really high. And I'm sure, unfortunately, that's something a lot of people can relate to. And sometimes this attendee shares he can't afford to pay for it. He wants to know, is the PAN Foundation able to help with that particular cost? And again, that's for heart failure medication.
Gotcha. So the first thing that he could do is check our website to see the status of our heart failure fund. If the fund is open, he can apply directly from our website, the portals, or giving us a call. In most cases, we pick up 100% of the patient's responsibility in regards to their medication without having to pay any out-of-pocket costs. We will pay up to the grant amount of the patient's responsibility. And if the fund is closed, I recommend that he add himself to the disease fund wait list to receive a notification when the fund opens to apply.
Yeah, be sure. Thank you, James, and thanks for the question. Be sure to get on that wait list if the PAN Foundation doesn't at that time have a disease fund open to meet your needs. So we're going to go ahead and wrap up with one last question, which is, what if the primary insurance has not paid the claim? Will I miss the timely, and I will miss the timely filing period? That's a great question. What to do then?
Okay. So if there's a delay with an insurance payment, and as a result, you miss the timely filing deadline of 60 days, please call us before the end of the 60 days for assistance. We will take this circumstance and other extenuating circumstances into account and consideration. Likewise, if you know you will miss the grant use policy date due to similar circumstances, please contact us and we will consider this as well. We ask patients to please be as proactive as they can in matters dealing with payments.
Fantastic. And one of the common denominators you will see in listening to James' responses, as well as other PAN Foundation webinars, is that they are looking for feedback and they are really going to be above and beyond to offer a number of ways to stay in touch with the PAN Foundation. And it's important to do so because I'm proud to say, and this is one of the reasons that we are so deeply grateful for the partnership we have with the PAN Foundation. We have seen the services they offer grow over the years, as evidenced by the Transportation Assist add-on, Fund Finder, because they really, again, go above and beyond to help those they serve as best as they can. So be vocal in your experience and what you're looking at, and use all those other platforms and outlets and ways to stay in touch with the PAN Foundation. And certainly follow them on social media. It's a really easy way to stay up to date on what they're up to. So as I said, we're going to keep that question segment brief. You'll hear from us via email if you asked a question we didn't answer. But again, if you need a more timely response, reach out to that PAN Foundation at panfoundation.org or 866-316-7263. Thank you so much, James, for taking time out of your very busy schedule to showcase how the PAN Foundation can really make a huge difference in helping those living with rare disease get their health care expenses met. And thank you, of course, to the Needy Meds audience for joining us today. We do hope to see your name pop up in future webinars. Thanks so much, everybody, and have a happy rest of the day. Take good care. Bye.